Hi, this is Steve Ulrich again with another video on lowering employee healthcare costs without reducing benefits to your employees. In this video, we want to discuss briefly how using a plan with this structure can also not only hold down the costs currently that you're having or reduce them significantly, but hold them down going forward in the future as insurance rates continue to climb. And here's the first reason why. In a plan like this, we have several moving parts and different components as opposed to just be fully insured and insurance covers everything. And so we're going to have the component of the savings from having taken a larger deductible, and so the actual amount of insurance is going to be a much smaller component of your plan now, a much smaller percentage of it. Then you have the stop loss on the back. So if rates do go up, let's say hypothetically they go up 5 or 7%, whatever, it doesn't matter what the percent is, that used to go up on 100% of your plan. Now, whatever the rate increase is only going to be a fraction, it's only going to affect a fraction of your actual plan. Secondly, another reason that you can help hold down costs is that we work with some excellent third-party administrators. And these are active, and their goal is to actually help you get the least amount of insurance necessary to fully cover the needs of your business. So rather than trying to get you to buy as much insurance as possible, we're going to try to figure out how to get you to purchase the least amount of insurance possible and still have the same coverage. So I'm going to give you a very elementary example. You may already be doing this, but just for example, employees oftentimes during cold and flu season will go into the emergency room. And the third-party administrator is going to catch this. They're going to say, hey, you got a lot of emergency room visits for the flu or the cold. Well, that turns out to be a very, very expensive visit going to the emergency room. And they don't get better care by doing that. And so just do some education. You can talk to your employees and say, hey, when you get the flu, the way to hold down not only our costs, but your costs, even go to the urgent care, would be much less expensive than going to the emergency room itself. So those are just a couple ways. They have much more sophisticated things you're going to look into, maybe education on diabetes, different things like that. But as you solve these problems, the next year, if rates do go up, you may be, having solved those problems, may be able to take even a larger deductible than you did the previous year and offset the increase in cost that way as well. I hope this video has been informative. If it's intrigued you at all and you'd like to learn how these concepts might help you lower your employee healthcare costs, and sometimes significantly, without lowering or reducing the benefits to your employees, you're welcome to email me at steve@optimizeyourhealthplan.com or call me at 760-500-6514. I look forward to hearing from you. Thanks.